patient might first slowly notice that they have increasing stiffness in their back or their neck. And again, we use the term insidious, which means it can be very slow and kind of sneaky. They don't really realize it except over time, maybe over several years. And then the back pain. And again, inflammatory back pain, which is generally worse at night, worse in the morning, better as activity or the day goes on. Again, buttock pain, gluteal pain, pain at their heels or the soles of their feet. Again, part of this enthesitis, the inflammation of the tendons in the Achilles or the plantar fascia. So those are usually the things that will bring somebody in to see a rheumatologist. If it's gone on for a while, only then they might notice that their back is physically looking different and stiff. Typically that isn't something they will notice except over years if it progresses. So it can affect the outer joints. We'd call them peripheral joints. They can be inflamed. In many patients, they'll also have inflammation of the tendon insertions. We call that enthesitis. An enthesis is a tendon insertion. So many patients will come in with Achilles tendonitis, plantar fasciitis, chest wall pain, rib pain, but it's really enthesitis. So that's another predominant feature. Psoriasis, which is a scaly chronic skin disease, as well as inflammatory bowel disease, such as a history of ongoing diarrhea or blood in their stools or abdominal pain with diarrhea, as one might find ulcerative colitis and Crohn's disease. Very rarely it will cause inflammation that may lead to valvular heart disease at the aorta, and that's very, very rare, as well as fibrosis in the upper lungs. And then eye disease. Eye disease is actually not that unusual. It's inflammatory eye disease, and sometimes that's the first way a patient will know they're ill. They haven't really realized that their back is getting more stiff, and they'll go to a doctor because their eyes are painful and they're red, and they'll find that they have uveitis or anterior uveitis, which is called iritis. So it can be a very diverse presentation, but they all, for the diagnosis of ankylosing spondylitis, they all should have inflammatory back pain and decreased back movement in two planes and X-ray abnormalities at the sacroiliac joint. So that's always got to be there for the diagnosis of ankylosing spondylitis. But these other things can be very diverse and be present at some point in their history.